Welcome to Fuzzybutts and Friends. Well, this is a very special episode. This is a first for us here on Fuzzybutts and Friends. We'd always designed the show that we wanted to be able to invite our guests back on to talk about their products or services or whatever they're doing out there for Fuzzybutts. It's new and exciting. So this is our very first. We're not sure what we're going to call it yet. It may be Fuzzybutts and Friends. Fun and fast facts. It may be called Fuzzybutts and Friends 15 because we're going to try to limit these podcasts, these episodes to just 15 minutes. So to set off our very first for Fuzzybutts and Friends, we're happy to have back with us this very first episode, Jeff Sutherland. He's the CEO of Canine Biologics, and they're doing some very exciting things in nutrition and companion animals. So to keep this thing in the spirit of Fast 15, Jeff, go ahead and take it away. What do you got?
Well, thank you very much, and it's a pleasure to be back. I really do appreciate it. So as you may remember from our last visit, Canine Biologics entered the market a couple of years ago with a specialty nutrition system for dogs with cancer, and that obviously was featured on your earlier podcast or episode of Fuzzy Butts. Today, I'd like to really get into a new product we just introduced about a month ago, and it's called Nutradapt, Adaptive Liquid Nutrition. And where this is used is in the clinics for dogs or cats who are under kind of a critical care situation. They've had an accident requiring surgery, they've had other significant trauma, or they're in for a significant disease condition like pancreatitis or kidney disease. And there's a list of about 32 that we accommodate with our new nutrition system. So mostly this is meant for liquid feeding. So if a dog or cat requires a tube or syringe fed situation, like a tube down their nose called a nasogastric tube, this is the product that would be fed to the animal. But to really understand what we're doing, you have to kind of peel back a little bit and think about what's being done today. And the state of the art, which really hasn't changed in probably 50 years, is to take a can of soft food and mix it with water, blend it up, and try to get it to a consistency that can go down sometimes very tiny tubes. Think of a kitten or a young puppy where you've got a tube going down their nose. That tube has to be very small. Not only is that the state of the art pretty much, but it's messy, it's smelly, it's inaccurate, and it provides a system, if you will, that is fixed in the amount of fat and protein it provides. In other words, you can't say, well, this dog has kidney disease, so we're going to lower the protein, because the protein ratio is the same, right? It's a canned food, and all you're doing is adding water to it. Or we have an animal with pancreatitis, and we want to lower the fat level. Again, you can't alter those levels because they're fixed in this particular type of food. So it's a very limited range, and it's kind of a one-size-fits-all situation. And as we know, when you get one size fits all, it means one size doesn't feed anybody really well. The other kind of drawback here, or one of the primary ones, is it takes a long time to set this up for a given patient. There's a lot of calculations that have to be done for calories, how much water to add, how fine we can get the resulting gruel, if you will, and the fact that it often will plug up these tubes as they're being used to feed the animals. There's lots and lots of problems with this kind of system, but it hasn't changed in about 50 years. What we did is we've come up with a new system that is several components. The primary or a very important one is software. So what we do is we provide the ability for the clinician to enter information about the animal, right? This dog is 3 years old, it weighs 20 kilograms, it has pancreatitis, it hasn't eaten in 5 days, et cetera. So they can enter about 15 fields of information, takes less than a minute to do. And the system comes back with what we call a recipe. And that recipe then tells them how to blend the various components of our system to get the exact levels of calories, fat, and protein that are meant to feed that kind of an animal. And if you don't mind, I'm going to share a screen here, and kind of will give you an overview of the system. So since we're on Zoom and we have the magic of technology, I'm going to share a screen.
Let us partake in the magic of technology.
That's right. So what you should be seeing now is kind of a banner for us, which is the system indicating it's tube fed. You see the hand on the right with the syringe and the tube and so forth. And actually our product looks very much like that. It's kind of a light yellowish blend, kind of like a very thin milkshake when it's all put together. And then on the right side, what you see is a representation of the software and then the components that make up our system. And what the software will do is tell the clinician or the vet tech or whoever is going to be mixing this, take so many grams of the base diet, which is the number one orange kind of pouch you see there, and mix it with varying levels of protein boost, which is number 2 for either a dog or a cat. And then number 3, which is called our fat boost. It's a custom blended oil that is meant to be very anti-inflammatory. It has a very specific ratio of N6 to N3 fatty acids, and it limits inflammation by its very nature. So the bullet points you see here is number 1, we're software assisted. Number 2, we can be condition specific. And what that means is in the software, there are 32 different conditions, everything from diagnosis pending, which means I don't have test results back yet. I'm the veterinarian and I'm waiting for my test results, but I'd like to get some calories into this animal. So we have kind of a base level diet for that situation. Or I've already diagnosed this animal and it has kidney disease stage 4. So it needs a very protein and phosphorus restricted diet, which our base diet is. It's a low phosphorus, low protein, low fat, the number 1 pouch. So the animal might only get that part of the product set mixed with water. All of these things, you mix them with a certain amount of water, and then you can put them into the syringe and down the tube or directly into an oral feeding situation. So that's the heart and soul of it. But unlike today, where veterinarians tell us time and time again, it takes around 45 minutes, some say an hour, to set up an animal, do all the calculations, understand what they're going to feed, perhaps mix it with another product like Ensure or Boost from the human realm, along with the canned product, the canned, cat or dog food. This is very, very kind of mix and match and kind of messy and hard to get together. We can do all that in under 5 minutes. We can not only provide the recipe mix for a given specific condition, but the technician and vet together can be ready to feed the animal in under 5 minutes. And as you probably know, most veterinary practices are extremely busy today, and anything that can save them time is a big, big win. And what we do is not only save them time, we provide accuracy, documentation. There's a whole record generated from here that can be incorporated with the electronic medical record system of the given veterinary clinic. So it takes out any need to write anything down. It's all documented. It provides a 1 or multi-day diet, depending on the situation of the particular patient. And it's specifically set so that patient is getting the right amount of levels of fat, protein, phosphorus, and energy and calories for their given age, weight, size, condition, etc. So this is a very hyper customized approach that's very accurate, saves a lot of time. So
Right.
in a
Well,
nutshell, that is the system.
it's great. It's a wonderful tool. Technology it's fascinating, and time is critical. Time is of the essence. I really like that. That's the value proposition from 45 minutes to 5 minutes. And as you and I have discussed in the past, Jeff, with dogs that have cancer, cachexia, it's such a critical situation. You got to get nutrition to them constantly, and that whole feeding them, that process is arduous, and sometimes it's a deterrent. But I want to clarify, Jeff, something really important up front. Is this tool only available to veterinary practices right now?
Yes, it is only sold to veterinarians, and the reason is very critical. The animals that are being fed this way are in a critical care state. Now, very often we can recover them back to normal health. But while they're in that critical care state, how they're fed, the amount they're fed, the timing of their feeding, et cetera, is very, very specific. So we want to remain under veterinary control while that's occurring. Now, having said that, there are some situations where the animal may go home and be on chronic longer term feeding with a tube placed either down their nose or perhaps surgically placed. And in those situations, the clinic would sell this product to the pet parent, and give them a recipe and a meal plan so that they can mix it up and use it at home. So it is available to be used at home, but not directly, not as a retail product, but only through the veterinarian. And we want to maintain that level of control and monitoring that the vet will be able to do if they're the ones that kind of control the flow of the product.
Sure, that's important because we're dealing with nutrition and critical conditions, critical states, and you want to get the math right. You want to know what you're doing, and I'm a big fan of that. But hopefully one day maybe you can have something available that are pre-filled syringes or something that are available for pet parents, because I know in the 3 dogs I've lost to cancer, feeding them is just such an arduous. But that's why your other products are so wonderful and so innovative as well. Let's see. I got the white paper off your website. Is this white? There you go. I was just going to ask you. You're a handsome fellow. Wanted to see that face of yours if you were done with that. So I got the white paper. Is this white paper available online for pet parents, Jeff?
Not quite yet, but we do have a lot of other information at nutradapt.com.
Okay.
And I will make that white paper available as well. That's a slightly edited version that we provide to veterinarians. So I will be putting that up. But nutradapt.com has quite a bit of information in our FAQ section, for example, that talks about this product set, how veterinarians can use it. And you asked an interesting question. I do really want to clarify, because you talked about perhaps someday we might have a pre-filled syringe, et cetera. We did this specifically to get away from that point of view, because when you do pre-filled or pre-mixed, then you're back into the kind of current system where you're trying to use one product to match multiple needs. And what we have designed is a product that can match very specific needs one at a time by following a recipe generated through the software. So while I'm not saying it'll never be available directly to pet parents, it wouldn't probably be available in a pre-mixed format, because that's what is kind of wrong today, is that things are preset, pre-mixed, pre-leveled, if you will. And ours is not. Ours is only leveled or mixed, or set ratios are formed when the information about your pet is entered by the veterinarian.
Correct, and that's really the linchpin, right? That's the keystone. If you think about it, is that they need to acquire that real-time data. They need to capture that data about what type of nutritional needs that your companion animal needs at that particular moment. Get that snapshot, and then customize the recipe for that at that moment. And then whether it's a couple of days or a week, take another snapshot, look what their diet nutritional needs are, and then maybe reformulate the recipe is how it works, correct?
Well, and that's a great point, because depending on a specific condition, and here's a very specific example. If a pet comes in with a given complaint, let's say it's pancreatitis, but they also haven't eaten in, say, 5 days, you have to be very careful about how much fluid you introduce into their gut, how much nutrition you introduce, because you don't want to overwhelm it. It's called refeeding syndrome. There's a very specific, diagnostic state there. So what we do in that instance, where the dog hasn't eaten in 5 days, or the cat, we provide a meal plan that ramps up over 4 days. So it starts them at a low level of nutrition and calories so that their gut can deal with that, and then kind of wakes the gut back up and ramps up to a more full level of calories and protein and fat and so forth. So you brought up a great point. It's not only specific to the animal, it's specific to the day and even the meal if they're fed 3-4 times a day. So we can get down to that granular a level. And that can be very critical to avoid some of these problems when you're bringing a cat or dog back onto nutrition. And one other quick example, you've had an animal hit by a car, an otherwise healthy animal, but it's been under anesthesia, it's got pain meds, and what often happens is you develop what's called an ileus, or a stoppage in the gut. So again, you want to wake it back up slowly and not overwhelm it. So in that situation, we would begin feeding at a kind of a low level for the first day, slightly more the second day, and then ramp up slowly through 4 days so that we don't overwhelm that particular patient. Does that
Right.
make sense?
Absolutely. I actually fasted for 18 days after I lost my second dog to cancer, 10 for the first dog and 8 days for the second dog. So 18 days. Before I did it, I didn't understand how deadly refeeding can be. And I learned after that it can be extremely dangerous and potentially deadly. So what you're doing is phenomenal. But what I find also fascinating about this conversation, Jeff, is I'm a big proponent of direct to marketing to pet parents, which is how it's done in human medicine. Pardon me, but it's not currently done that way in veterinary medicine. And so that's sort of what this podcast, Fuzzy Butts and Friends, is. The spirit of it is trying to get the correct data to pet parents as quickly as possible for them to make the best decisions, medical decisions for their fuzzy butts. So now that we know, when we've established that this is available only in the veterinary clinic setting, as it should be, because a critical situation is so dynamic, we know that all vet clinics don't have yet, obviously, Canine Biologics, Nutradapt, liquid nutrition. So as a pet parent, and I'm thinking, okay, if my fuzzy butt gets hit by a car, and I have to take him to my emergency clinic or to my GP, I need to make sure my GP has the Nutradapt, Canine Biologics for it. So is there anything that pet parents can do to make sure their vet clinic, their local vet, their general practitioner, or their veterinary oncologist, how can pet parents help educate or raise awareness to veterinarians who should know about it, but as you and I know, not all professionals do. So what can we do, Jeff, pet parents?
Well, it's a great point, and as you point out, or as I pointed out, we're brand new. We've been on market for a month with this product. We're in a number of clinics. The vets are absolutely loving it. We're getting tremendously good feedback. Everything from this is the holy grail of nutrition. That's a vet quote. I didn't make that up. To why didn't someone think of this sooner? We've had several vets say that. So it is being well accepted by those that know about it. But again, we're brand new. So what the pet parents could do is mention this Nutradapt or nutradapt.com to their veterinarians to get that knowledge out there. And I know I'm biased here, and please accept that up front. But if my pet were hit by a car or had pancreatitis or some other critical disease and needed the effective setting of an ICU, which is kind of where this is popular in emergency clinics, I would want this nutrition for them. It's been used on parvo puppies as young as 4 or 5 weeks with tiny, tiny tubes. It'll go down. And what's important about that is our product has some of the highest energy, the number of calories per milliliter, if you will, per amount of food of anything on the market. So the amount of volume of fluid introduced into the animal can be kept to a minimum. And that helps, again, not to overwhelm their gut and so forth. So we're high energy density, we're customized, and we really, again, I know I'm a little biased here, but the vets are telling us the same thing. This is the best approach for nutrition for a critically ill animal or an animal under critical care that's been available so far. So we're very enthused about this.
You're supposed to be biased. You're supposed to be the cheerleader. That's your job. That's the way it's supposed to go. But we're also supposed to have the other piece of that is clinical data. So Jeff, what clinical data do you have thus far? I know Phil Bergman will give me a gold star for asking about that. I'm a data guy. I believe you. I know it. We've talked before, and I'm a big fan of what you do. But the reality is, there's an institutional trust issue with drug companies and big pharma because they're over promoting products. It's a real problem. So what sort of tests or trials have you done so far?
Thankfully, we're not a drug company. We're not big pharma.
Right.
We're a small company located in Denver, Colorado. We only do nutrition, not drugs. And all of our products, including Nutradapt specifically, have been formulated by a full professor of veterinary clinical nutrition who has a PhD and is board certified in veterinary nutrition. She's out of NC State, their vet school, and she has formulated all of this. She's also been involved in the initial testing, and we have now about 10 clinics that are using it in animals almost every day. So we do have, we are accumulating more and more data. All of the components, unlike any other product on the market for this kind of use case, all of the food components in our system are 100% human edible. Now, I use that word edible and not human grade because human grade can get a little bit fuzzy at times. Every single thing in our pouches, the oil, etc., is human edible. So we insist on that because it provides the highest absolute standard of quality that we can bring to the market, to the veterinarians, and to eventually to the pets. So it's formulated by an absolute top level professional in the field. B, we've done initial research at NC State and in other clinics. C, we have clinics now commercially using the product. And D, we only use human edible components at the proper ratios and levels that are called for under AAFCO guidelines. Even though this is sold as a quote unquote supplemental product because it's not a normal meal, use case, we do follow for, in certain situations, depending on how this is blended, we're meeting all the AAFCO guidelines. So,
that's a very important. That's a really important distinction. It's really important to distinguish between that you're a nutritional company and not a drug company. That's a very, very important distinction. I just wanted to point out another important distinction is because we had tech problems, and Ginger, the executive director of the Puppy Up Foundation, usually schedules these. I don't have a professional account, and we only have 5 minutes and 40 seconds left on this podcast Zoom before Zoom shuts us down because I don't have a pro account. I don't know why. I don't usually schedule these things. My apologies, Jeff. So we need to go ahead and wrap this up, but we got, I think, all the bullet points that are important. Pet parents, please go to Nutradapt.com, learn everything you can about it. Have a conversation when you go in with your general practitioner or your veterinary oncologist, because my guess is your cancer patient probably might become critical at some point, and you're going to want this for sure. So learn everything you can at Nutradapt.com. Jeff, go ahead. What else?
I'd also mention for the veterinarians who may or may not hear this or may hear this, we are advertising in the Veterinary Emergency Critical Care Journal. They've accepted us as a product to be advertised in their journal. We're appearing in September of 2022 at the International Veterinary Emergency and Critical Care Symposium in San Antonio starting on September 8th. We'll be there. We are reaching out to vets every day, and we're making this available to all of them. We're already accepted in some very interesting emergency and specialty care clinics here in Denver and Seattle and elsewhere. So we've got about 10 on board now. This is
I have no doubt.
Really been exciting for the veterinary community. So we're really looking forward to it.
Absolutely. If you save, I've been in enough practices and talked to enough veterinarians on my travels. If you're able to save their staff 40 minutes or whatever that number is, that's a huge value add, huge value proposition. Never mind the huge value proposition for pet parents and their fuzzy butts. So that's a great point to wrap it up. Veterinarians, go to Nutradapt.com. You can reach out to Jeff Sutherland. He'll be at the conferences he mentioned. Also, their website is caninebiologics.com. Go check them out there as well. I'm going to go ahead and wrap it up. Jeff, thank you so much. It's great to talk to you again, to be on our first update, our Fuzzybutts and Friends 15, whatever we call this. That's it for this episode. To our audience, we'll talk soon. You can find out the regular episodes of Fuzzybutts and Friends drop every Tuesday. That's it. Puppy up. Talk soon.
Thank you so much. Have a great day.
Thank you, Jeff.
Bye.